testing for preventive health. So, Alan, over to you, mate.
All right, no worries. I might say up front as a bit of a disclaimer, I'm not a medical doctor. I guess when we're talking about blood tests, that can sometimes get a little bit confusing, but I'll talk a bit about that later on in terms of interpreting results and accessing blood tests and when to get medical advice as well, because I think that's an important part of this conversation. But I guess the focus this month at Fuelin is around preventative health. And obviously, a part of that is potentially blood tests from a general health point of view, but maybe for some specific health issues that are relevant to athletes more so than the general population as well. So we're going to talk about, I guess, when and why you might like to consider doing blood tests, what sort of blood tests you might want to consider. And I think one of the important parts in all of this, with any kind of data we collect, whether it's from blood test results or whether it's from any other form of data that we get, is the results interpretation and the taking action part is really important. It's one thing to get data, it's another thing to know what to do with it. And particularly when we're dealing with what's going on in our bodies, we're really delving into the medical area in a lot of cases. So we really need to be careful about this. It's very different to just getting some data off your Garmin or something. Okay, so I'm sure everyone's familiar with us. Maybe people aren't so familiar with Megan. Scott, do you want to say anything in this regard?
Yeah, I think it's always nice to touch on the team. Obviously, Alan. Alan's a fellow of Sports Dietitians Australia, has his PhD and is a researcher and a lecturer at Monash University. Megan is a registered dietitian in America, and recently joined the team and works with professional athletes from the RTS squad as well as age group athletes. My name's Scott Tyndall. I'm one of the co-founders. I'm based in Sydney. And Elizabeth is a registered performance nutrition based in San Diego and has a master's in sports and exercise physiology. And we make up the bulk of the team in terms of the nutrition coaches here at Fuelin.
Yep. Awesome. All right. So when and why would we consider blood testing? I think this is a really important point here is that, you know, in our society these days, we've got a risk of data overload, of collecting data for the sake of collecting data, whether it's blood testing, whether it's wearable data, whether it's all sorts of different metrics that we can quantify these days. And particularly when we're sticking needles into our arm and actually pulling blood out and getting results that might prompt us to act on those in certain ways, I think we need to be really purposeful with the testing that we're doing and not just testing for the sake of testing. And so I've kind of put it into three buckets here from an athlete's perspective in terms of what might be relevant or important to think about. And I guess the first one is just general health kind of screening, like you might do in a workplace health check or something like that, looking at chronic disease risk, because we're all human. At the end of the day, we're all susceptible to or potentially at risk of various chronic diseases. Obviously, being a very physically active group here, we're probably at lower risk potentially, but not to say that we're at no risk. And if people have a particular, family history of heart disease or diabetes or things like that, they'll probably be very cognizant of that already. Uh, as we get older, certainly age is a risk factor for most chronic diseases, heart disease and diabetes and things. So again, that's something that we might take into consideration. But we are all human, and as a general health check, we probably would be wise to look at what's going on under the bonnet, so to speak, every now and then. There's obviously then a layer that goes on top of that, particularly for people who are doing a lot of training, because there are some, I guess, potential health risks or things that can go wrong from a health point of view from doing large volumes of training. And so they can sometimes, not always, but sometimes be picked up on various forms of blood tests. So that is something that can be looked at as well. And then the final thing, which I think is sometimes underappreciated, is the monitoring progress part. So if you get a test result and then you have some sort of intervention, you change something in your diet, or you're prescribed a medication, or you change your training regime or something like that, you want to know what an impact that's actually had. If you've got a high cholesterol, you want to know that the cholesterol is actually improved. So often going back and doing that follow-up testing is the part that sometimes gets forgotten, but is really important to actually know that what you're doing is actually having an effect in a positive way on your health.
Al, quick one,
Mm.
just before you do, and you may be going into this. Are you going to cover those chronic type scenarios, the athlete specific scenarios? whatnot?
Yeah, we'll talk about specific tests shortly.
Yeah, cool.
Yeah, yeah. Now, one of the other things that we need to consider when we might be going away to do blood testing is, and it depends on the type of test, but for some tests, the timing in which you do that test is really important. Certain tests may show up certain things at certain times. Certain tests you need to be fasted for the result to be meaningful and able to interpret that result. So sometimes it's the timing in terms of timing around meals on the day that you go to do the test, but sometimes it's also the time of the year that you go to do that test, whether it's around summer versus winter, whether it's around certain times in your training cycle. Is it off season? Is it during a heavy block of training and things like this? This may impact on the results. If you're planning to go to altitude, or use an altitude tent or something like that, again, timing of some of these tests may be important around those sort of things, and we'll cover those off shortly in terms of some of those considerations that you might need to make in terms of timing. So here's an example of various different tests that you could potentially look at that probably have a crossover around athlete health, but also particularly the nutrition element. Obviously, that's our focus here at Fuelin. And I've sort of lumped them into things that have very specific timings around them and things that maybe are less time critical in terms of doing them. So if we start on the far left and talk about sort of general health screening, you can look at what's happening in terms of things like your diabetes risk, things like your omega-3 index. They could be theoretically done at any time, assuming that your diet's not changing dramatically. Obviously, if you're someone who's quite sedentary and then you start an exercise program, maybe a different story. But if you're sort of consistently training, that could probably be done at any time of the year. So I guess from a diabetes risk point of view, you might be looking at things like fasting blood glucose is kind of the standard one that gets done. I think increasingly these days, fasting insulin gets looked at as well. And particularly in the context of type 2 diabetes and trying to pick up potential progression towards type 2 diabetes, you're probably going to see that in the insulin before you see it in the glucose, so you can potentially pick it up earlier. And then blood lipids, looking at your cholesterols, your LDLs, your HDLs, all those sorts of things in terms of heart disease risk is another important one. And as I said, that's really not athlete specific. And in a lot of cases, athletes are actually at lower risk, but not all athletes are at lower risk. And there may be athletes that have, family histories of these kind of diseases where you really want to keep on top of that. HbA1c really tracks, I guess, more of the sort of the medium term trends in blood glucose rather than what it is at this exact moment in time. And so that can be helpful as well. Omega-3 index, I won't talk a lot about this. There's been a previous session on that, and I think Elizabeth's talking about that again next week as well. So I won't go into detail here, but it is kind of one of those more novel risk markers that we can look at around cardiovascular disease that might be helpful and might give us feedback in terms of our dietary intake of omega-3 fatty acids as well. Now, some of the ones that may be a little bit more specific in terms of timing, some of these might be timing around training, but some of them are also around times of the year. So probably the big one around times of the year is going to be vitamin D. And vitamin D, as most people are probably aware, most of our vitamin D is actually synthesized in our skin from UV, from the sun. And so generally, most of us, if we're getting outdoors a fair bit over summer, will have pretty good vitamin D over the summer, particularly for this group of listeners and viewers. Obviously, you're all going to be outdoors doing a lot of your training, probably in summer, so you're going to get a reasonable amount of sun exposure. So vitamin D is probably not a high risk proposition in summer, but there are other populations where they spend most of their time indoors, and even in summer it's an issue. But for triathletes in particular and other endurance athletes, probably summer is low risk. Now, generally, doctors would recommend testing vitamin D towards the end of winter because theoretically that's going to be the lowest point of the year in terms of your vitamin D. And I've always thought, well, that's nice, but you've kind of missed the boat. You're picking it up after it's been a problem for 2 or 3 months. Wouldn't you want to know if you're already trending low when winter is starting so you can do something about it and not sit in that state of vitamin D deficiency throughout the winter? And so I would generally recommend that someone gets a vitamin D test sort of towards the end of autumn or fall, just as you're going into winter. And if it's already towards the lower end of the range, then you might have to think about supplementation because it's only going to go down from there for most people in most parts of the world. Certainly, you might want to test it again at the end of winter just to see how things have got along, whether the supplementation that you've used has been effective or not, that sort of thing. That could certainly be useful as well. Now, I've talked about pre-season here, and I've lumped that into late winter. This is kind of making a bit of a generalization that people are sort of planning most of their racing around their summer and then having a little bit maybe of downtime or base training over the winter months. It's not always the case necessarily. You know, you can compete in triathlon year round or travel to other parts of the world and compete in your winter. So take that, I guess, a little bit with a grain of salt. But I guess what we're talking about here is maybe at the start when you're going, before you do your big training block, that might be a good time to sort of get a checkup on things from a nutritional point of view. So not only vitamin D, but it'll be things like vitamin B12. That's going to be particularly important for people that have predominantly plant-based diets, vegetarians and vegans in particular, because a vegan diet, by definition, unless you've got fortified foods, is going to be lacking in vitamin B12. So it is one that, you know, most people on a vegan diet are hopefully aware that B12 is a particular concern and one that needs to be regularly monitored for them and probably supplemented. But just to be aware that can be an issue for some people. And generally, when you test B12, you test folate as well. And the reason for that is that the two are very closely intertwined in terms of how they work in the body. And sometimes it's hard to unravel without both results what's actually going on. The other one that I think is a good idea to do sort of in the early part of your season before you really get into big blocks of training is to get a bit of a baseline of your iron status and what that's doing. So when that big volume of training comes, and that might impact negatively on your iron status, you've got a baseline to compare it back to. So generally, when we want to look at iron studies, it's not one single test that you look at. There's a panel of about 4 different tests that look at different aspects of how iron is stored and transported around the body, and you really need all of those tests together to interpret them to get a full picture of actually what's going on with iron in the body. So generally, if you request iron studies, that will cover all of those tests as opposed to just testing serum iron concentration, which doesn't tell you a lot on its own. And the other thing
Al,
that
can you just outline what those parameters are in the iron studies that you would
oh,
be interested in?
yeah, so the iron studies, it probably varies a little bit from lab to lab in what they incorporate into that, but generally speaking, it would be the serum iron concentration, which is actually probably not so useful out of all of those tests. There's the ferritin, which is probably the most useful. It's a protein that stores iron. There's the transferrin and the transferrin saturation. And sometimes you get total iron binding capacity as well, but it's those combination of things that has to be interpreted. And generally with iron studies, I would absolutely recommend going to a health professional to interpret those because it can be quite tricky to kind of unpack these combination of values and work out what's actually going on. So definitely that's one I would recommend interpretation from a professional.
And they'd be looking at your hemoglobin levels as well, wouldn't they? In
Well, that's then,
conjunction
yeah.
with
So
that,
that's,
because that's
yeah.
going to
So,
define iron deficiency or iron deficiency anemia.
yeah, so that's where the full blood count comes into it. So that's the
Yeah.
other thing is if you're doing iron studies, usually doctors would probably request a full blood count at the same time because as you said, Scott, you're going to look at hemoglobin, which it's kind of the last domino to fall in the, I guess, continuum of iron deficiency. It's not until you become severely iron deficient that hemoglobin starts to fall. But it does help, I guess, give you a bit of context. So if you've got a low ferritin, for example, if the hemoglobin is low as well, things are probably worse than if the hemoglobin's kind of normal. So yeah, you generally get those done together. Another one that you might get tested, and I think the availability of this varies a lot from one country to the next. So it may not be available where you live. Certainly in Australia, I think it's hard to get. In the UK, it's relatively common, and I'm not sure about the US. Scott, you probably got more experience around that than me. But
They
he's
can
actually
certainly
looking.
request it. They can
Okay,
certainly
cool.
request red blood cell
Yeah.
magnesia.
Yep. So magnesium is another one. It's an interesting one because there's been estimates that up to 40% of the population have not a severe magnesium deficiency, but probably suboptimal magnesium status. There has been some debate whether red cell magnesium is a good reflection of that. It's probably the best that we have, regardless of whether it's perfect or not. It's the best indication we've got at this stage. So particularly with the minerals, we have to be really careful how we interpret those, because just measuring what's floating around in the blood doesn't really reflect the stores of most minerals within the body. Magnesium is the same, but if you look at the bit that's attached to the red cells, then it probably is a bit better indication of what's going on. All right, so that's kind of the ones that you might get in the late winter in the vitamin D case, or as sort of a baseline before you go into the big part of your training and competition season. I guess if you're during a hard training block, what are some of the things that you might be particularly mindful of looking out for? Well, the iron is kind of the obvious one that may fall during that period. And again, red cell magnesium is the other one to possibly do a follow-up on and see whether it has actually dropped compared to the baseline value you did before you really ramped up your training volume and intensity. So they're two that you probably think about keeping an eye on throughout your season. And the other one from a timing perspective, and I mentioned this earlier, was, if you're going to do altitude training, either genuine altitude training going to altitude or simulated altitude training with a tent or something like that, you probably want to get a baseline of your iron status 2 to 3 weeks before you plan to do the altitude. And the reason for that is that your iron stores are almost certainly going to drop as a normal kind of adaptation to altitude. And if you're already a little bit on the low side, or even just at the lower end of normal, most health professionals would probably recommend 2 or 3 weeks of supplementation before you start that altitude exposure. So you need to have that done, at least kind of 2 to 3 weeks before, and get that result back so you know whether you need to kind of really ramp up that supplementation in anticipation for altitude. I mean, probably most people will supplement once the altitude exposure starts anyway, but some people may need to get a little bit of a head start on that.
Good. With the hard training block as well, would you consider B12, or would B12 just be based on follow-up based on their initial baseline? Does
Yeah, I think
B12 get
probably follow up.
impacted through hard training?
Um, Not that I'm aware of. Maybe a little bit. Yeah. I think if it's relatively normal at baseline, I wouldn't be massively concerned about it, unless again you're on a vegetarian or vegan diet. You'd probably
Yeah,
be checking up more regularly anyway,
a
and so that would
follow-up
probably
anyway.
fall during that period regardless. Yeah. Yeah.
And do you ever, I mean, your views on zinc, just for athletes,
Um,
do you think it's required as sort of a baseline test? And I've read sort of varying accounts of deficiency of
mm,
zinc in
mm.
athletes. Do you think it's important?
Yeah, I mean, the hard thing with all of those minerals, as I was saying before, is that, the blood values of those don't
Yeah,
always reflect very well what's going on in the body. Blood calcium is meaningless. And most of the minerals are pretty meaningless, to be honest. I haven't looked in a lot of detail at zinc. And like magnesium, just measuring free magnesium in the blood again is useless.
yeah.
You have to do the red cell values. So yeah, I'm not as familiar with zinc. I haven't heard that specifically um, being used as a regular test with athletes. No.
And then the only
Okay.
other thing would be for athletes. I've had some athletes more recently come to me with heavy metal screening.
Hmm.
Is that something that you would recommend, or is it more based on an individual basis, based around sort of their nutritional intake if they are eating, say, a lot of tuna or swordfish and things like that? Is that
Yeah, probably.
you wouldn't blanket screen for heavy metals, you would be more based on
No,
their
no, not
individual.
unless you were particularly concerned about it for one reason or another, whether it's because of dietary intake, whether it's occupational exposure, like your job
Yep,
exposes you to an environment where more of that might end up in your body for some reason.
yep.
But yeah, probably not as a blanket rule.
Awesome. Thank
Cool.
you.
And I guess even if you did, it probably wouldn't be necessarily a regular thing. It might be once every few years or something, just to keep an eye on it. Yep. I threw in here a couple of other tests that aren't technically blood tests, but I think are useful to consider in this overall picture of health screening and testing from that perspective. One is blood pressure, and that may have implications around your use of electrolytes and particularly sodium around that. So if you're someone who does have high blood pressure day to day, you may have to rethink, I guess, how aggressively you go with sodium potentially, because that is going to potentially make that blood pressure situation worse. And the other one is bone mineral density. We know that endurance athletes are at risk of low bone density or lower bone density compared to the general population of the same age. and especially in cycling. So pure cyclists are probably the highest risk category, along with rowers for quite low bone density. Triathlon, because of the impact force of the running, are probably have a little bit more protection than pure runners again as well. But cycling in particular is quite a high risk sport in terms of low bone density. So again, that's probably not one you need to get done every year. Unless it's on the low side and you want to monitor it a bit more closely. But if it's kind of normal, probably every 2 or 3 years is adequate in most cases.
I think to your point, Al, as well, what you said right back at the start is like creating that baseline.
Yeah,
And as you said, like you get the baseline done, and we've certainly seen a lot of, lower than expected numbers on the Fuelin athletes, and even though you'd expect them to be good. So I think if you get that baseline done, if everything's great, as you say, monitor at, a respectable sort of interval. But if things are not great, then yeah, you intervene and reassess at maybe
yeah.
a slightly more frequent um, cadence.
Totally. And that's
But
probably
it's,
when you're then going to get professional advice around that as well, because
yeah,
you're going to have a problem that's been identified and then get in contact with, a physician or a dietitian or whoever it is
endocrinologist,
to work
dietitians.
with you on that. Yeah.
Yeah, that's a good point.
Um, Now, I think the hardest thing with all of this, with blood tests, is we're not all medical doctors. So we're going to get all these results back. And if we've, it's different in different countries. In some countries, you can't even get a test without a doctor writing an order for a test in the first place. And then they're kind of the gatekeepers to accessing those results as well. And, people argue there's sort of pros and cons of that approach. I don't have a strong opinion one way or the other around that. But I guess the risk here is that people go out and do a blood test panel themselves. They get the results back. They don't know what it means. They jump on Dr. Google, and all of a sudden they're diagnosing themselves with all sorts of weird and wonderful things that may or may not be true. So this is where I definitely recommend, for interpreting results of blood tests, you do seek professional advice from a qualified health professional for this, because you can, get very anxious and build up a whole lot of stress about absolutely nothing, or completely overlook something that might be particularly important as well. So interpretation is really important here. The other thing I'd say here is that for people who are doing a lot of exercise, you probably need to seek advice for someone who is familiar with interpreting these in the context of athletes. I don't know how many times I've heard of people say, "Oh, I went and got, my blood test done, and I went back to my GP, and they're worried I've got kidney failure or liver failure or something like that, and they're really concerned about it." And I'm looking at the results, going, "Well, no, that's just a normal result for someone who does 15 hours a week of training and eats 2 grams per kilo per day of protein. It's nothing to be concerned about. We know it's completely harmless. It just changes how you interpret those results." So whenever you can, try and get, the sport and exercise medicine physician is what we call that, sort of sports physicians in Australia. It's going to be different probably in different countries, or sports dietitians who are well familiar, or other health professionals that are well familiar with interpreting blood tests in the context of athletes doing large volumes of training and eating large amounts of food is going to be really important as well.
How often do you see that AST and ALT and they think they've got liver failure?
Yep.
And it's like, oh God.
Yep.
The same
Or
with
the
BUN.
or
Yeah,
creatinine and urea
creatinine
are the other
and
ones. Yeah.
and CK levels, they think they've had a heart attack. And
Yep.
it's like, no, they
Yep.
were just
It's
exercising.
muscle damage. Yep.
Yeah,
And on the
exactly.
opposite side too, if they're as long as they're within the ranges, even they're at the very bottom of the vitamin D, the physician will say, "You're fine, you're in the range." And it's like, well,
Mm,
we know better. So context
mm.
matters.
Yes. Yeah, absolutely. Yep. Um, Now, testing ultimately is useless unless it informs some form of action. Now, sometimes you get results and they're completely normal and it's fine, and the action is, I don't need to worry about this for a period of time. And that's fine. But I guess the thing is, there's no point going out to do a test if you're not planning to take any action based on the result of that test. Now, again, health professional advice is probably recommended here, because it's not always going to be obvious what action you should take, or to what extent you need to take that action. If you've got a bone density result that comes back and it looks a bit on the low side, is that a concern? Is it kind of normal? Is it panic stations? How low is too low? That kind of thing. As Elizabeth just said, if your vitamin D is at the bottom of the range, do I need to supplement? Well, If you're coming into summer, maybe not. If you're coming into winter, probably yes. So there's a whole bunch of nuances and context around this. And I don't think it's anything we can really distill into a short Q&A session like this. I think this is where you really need to seek individual medical or health professional advice around that. Follow-up testing. I mentioned off the top, this is really important, and I've lost count of the number of people who went and got a test and found they had low iron and then started iron supplements. And I said, oh, well, did you go back and test to see if your iron's improved? Oh, no, I just kind of forgot about that. I don't know. And 6 months has gone down. It's like, well, you might be normal iron now. You might not need the supplements anymore. It might be a waste of money. Or conversely, the supplements might have done nothing and you're still iron deficient and you don't know it. So follow-up testing is really important here. If you're going to then put in an action or an implementation, as I said, it could be starting a supplement of vitamin D or iron or B12 or whatever it is, or it could be, your doctor prescribes a new medication or something like that. Or it might be you change the type of training or the amount of training that you do, any of these things. You want to know what effect that's actually had on the markers that were of concern. Otherwise, you're really kind of shooting in the dark. So yeah, I definitely think that's really important. And again, it's going to be a bit about that interpretation. So my ferritin's improved, but has it improved enough? Is it improved as much as we would expect? Again, that's where you need that kind of professional support to really interpret that.
Thank you for stressing that out, because it's one of my biggest bugbears as well. Like, people love taking a pill, they love taking a supplement, or they love doing an intervention, but they're not necessarily that they feel better. And it's always that one, isn't it? Once you feel better, you're like, oh, everything's good. And it's like, well, no, let's actually see and like validate what you did as an intervention and see if it worked. And if it didn't work, okay, let's look at other things.
Yep.
It just doesn't happen enough, which is definitely a frustration. So, but thank you for pointing that out.
Yeah. And I think that segues into this point, which I also really want to emphasize, is seek advice before beginning supplementation, particularly high dose supplementation, and particularly the minerals. So your irons, your calciums, your potassiums, your magnesiums, these sorts of things, because there can be situations where actually supplementation can be toxic if the dose is too high and there was no need for supplementation in the first place. The classic one you see is iron athletes going out there going, oh, I'm a bit tired. Oh, maybe I'm iron deficient. So rather than testing, oh, I can't be bothered with that, I'll just take iron supplements. Now, there are a small group in the population that genetically have high iron, which ironically gives symptoms of fatigue as well. They go out and supplement and it makes things worse, and to the point where it could be medically unwise to do so. So again, you don't want to just supplement blindly without knowing where you stand with some of the, particularly the minerals in the first place, before you go out and supplement with them. And then again, that professional advice will give you some guidance about, how much do you need to supplement? Do you need 10 milligrams of iron a day or 200 milligrams of iron a day to supplement? Should you take it every day or every second day, in the morning or in the afternoon, before or after exercise? All of these kind of nuances around that will be person specific. So that's where having blood test data can really inform a lot of this supplementation, rather than just throwing eggs at a wall and hoping they stick, and hoping not too many of them stick at the same time, because then you're in trouble as well.
And our bit on supplementation as well, just also I think seeking advice from experts on supplementation can also save a lot of money by taking the correct supplementation and supplements that may actually work because they've actually got an effective dose. You touched on things like iron and that, which obviously have a measured dose, but there's a lot of these, what would you call them, multi-ingredient formulations that, yes, they may have iron in it, it may have a bit of vitamin C, but maybe the dosage of that individual ingredient within that product is actually ineffective. And so, hopefully, by seeking advice from people who understand this, they can save potentially a lot of money on a lot of garbage and actually just get straight to the fix. And then, as you say, assess that and reassess it and go from there.
Or the person who's taking 3 different supplements and doesn't realize they're getting 3 different doses of magnesium because they're taking them for 3 different reasons.
Correct. And I think, I know Elizabeth will talk about this, but omega-3s is the classic one as well. They see on the front of the label, oh, it's 1,000 milligrams of fish oil omegas. and then you dive in and it's like, oh, per 3 capsules actually only gives you 300 milligrams of EPA DHA. And it's like, well, you'd actually have to take 30 capsules a day in order to get sort of, that higher dose if you are in the insufficient or deficient range. So yeah,
Yep.
supplementation is probably another one we could talk about in a lot of detail. And I know we've done some Q&As on that, looking at key supplements and things to look at. Maybe we can revisit that with time.
Yep.
Very
Awesome.
good. Yeah, that was awesome, Al. Shall we open it up? We'll open it up
Yeah.
to the.
Let's do it.
All right. Hey, did you have any questions first?
I will absolutely start it up. So let's say someone tests and finds out they're low in iron. They take a supplement, they retest, and it's like, okay, it looks good, and they go off. Should they be worried about getting low in iron again? Should they make dietary changes so that they're not low? Like, how would they navigate that?
Yeah, and I think that's where the advice comes into it. People can be iron deficient. Iron is probably the classic example. You can be deficient for all sorts of different reasons. Maybe you just don't have much iron in your diet. Maybe you have undiagnosed celiac disease. And I've seen people that have had no gut symptoms whatsoever, did a workplace health check and had a ferritin of 4, which is like through the floor. No symptoms of that would suggest celiac disease, but because they had this low iron, the physician's like, well, I think you need to get tested. Turned out they had undiagnosed celiac disease. So that could be a reason. It might be that, the form of iron supplement that you're taking is not effective or the dose is not effective. So there can be all sorts of different reasons why you either have or haven't responded to that supplementation. And so, yeah, you're right. Hopefully with some professional advice, you can kind of try and work through that, but also decide, well, when do you stop supplementing? If you get a result back and it looks good, things are returned to normal, well, fantastic. Does that mean you don't need the supplement anymore? Does it mean you still need the supplement, but in smaller doses, or every second day rather than every day, something like that? Again, I think that's where having advice in interpreting these results and what they mean and what to do next is so important, because you can't really distill that into a one-size-fits-all guideline that we could put up here and everyone can just follow it, because it's not going to work.
Now, in terms of, and just follow on from your question, in terms of, you mentioned things like the correct types of iron. Do you, as a dietitian, have particular forms of iron that you would prefer an individual athlete to trial as first sort of stage or first line?
Yeah, look, it's one of those interesting ones. A lot of it is based on, well, which ones have actually been researched. It's not to say that the others don't work. It's just we don't know how effective they are. So they might be as effective. They may be more effective. We just don't know. So the one that has the most research is ferrous sulfate, which certainly in Australia we have ferrogradulate. I don't know. Do you have that, Elizabeth, in
Yeah,
the US as a product?
it's very hard to
I
get
was
a
going to say
very
no.
good
Like, I
iron
think I ordered a
supplement in the
Canadian.
US.
Right. Okay. So that's by far the most common one here. It's the one, almost the first port of call for doctors in like GP clinics, but also in hospitals and things like that. That's generally what they would go to first.
That would be ferrograde C, wouldn't it?
Yeah. So the C has just got added vitamin
The
C to help with
added
the
vitamin C,
absorption.
but it's
Oh, there you go,
ferrograde.
Mike. Thank you.
There we go. Yeah, Mike's got it. You can buy it in
Yep.
a chemist. I mean,
Yep.
it's funny, in Australia, you don't even need a prescription for that now. They've
No.
really made it much more accessible, which has
Yeah.
its pros and cons as well.
Yeah.
Uh,
So ferrous sulfate is kind of the go-to simply because that's the one that's had the most research on it. The problem is a lot of people find ferrous sulfate gives them a lot of gut symptoms. Constipation is the main one, sometimes even pain and things like that. If that's the case, probably the second choice that tends to be used here is a product called Maltofa or Maltofer, depending on how you want to pronounce it. And it's, instead of ferrous sulfate, it's ferrous, I can't remember, it's bound to a form of carbohydrate polymer. I can't remember exactly what it is, but basically it tends to result in far less sort of constipation and gut issues. And actually, some people even find it goes the other way. They tend towards loose bowels with it. So for people who tend towards constipation, it actually can work quite well. If people have got kind of normal bowel function, it may actually make things a bit looser, and that's undesirable for them. So it's kind of swings and roundabouts. I think it's also important to recognize here that with iron supplementation, there are situations where, if absorption of iron from the gut is compromised, that no amount of iron that you put in your mouth is going to work. And we do see this, that the only thing that works is an intravenous iron infusion. And sometimes that happens. Sometimes it's because of things like undiagnosed celiac disease, and so if you figure that out, you can kind of resolve that issue, and then the oral tablets will work again. But some people, just for whatever reason, and some of it we don't fully understand, they just never respond very well to oral iron. There's a whole bunch of other forms of iron supplements out there, and every manufacturer will tell you that ferrous sulfate is a horrible supplement, so just use ours and you'll be fine. The problem is most of them don't have good research evidence. So as I said, they might be fine, but they might do absolutely nothing, and we just don't know. So, I mean, you're certainly welcome to try them and do a bit of an N of one experiment, as long as you follow up with a follow-up blood test to see if it's actually working. And again, that emphasis on do that follow-up test to find out whether, you start this supplement, is it actually helping you or not? Because if it's not helping you, why are you going to bother keep taking it?
And now just on that as well, like so the multifor is iron polymaltose,
Yep.
but it also has oh god, it's like sorbitol. It's got sorbitol in it, which if you take in a little bit too much, I think it adds to a laxative effect. So maybe that's why it's interesting that, but because it's quite sweet, I guess, because the that they're putting that in. But I tried ferrous sulfate. I had very low ferritin levels, and my hemoglobin wasn't great for a period of time. And so I was taking iron sulfate, and it didn't actually have much of an effect, but I switched to multifor on the recommendation of my doctor, and actually it worked really well. Same dose, just different form of iron. And to your point, it just worked very well for me. So I think, again, but the only reason I knew that the iron sulfate wasn't working is because I got retested.
Yeah.
And if I didn't get retested, I would have continued taking iron sulfate, and it was doing absolutely nothing for me. Whereas then I switched to the multifor, got retested again. I think it was 8 or 10 weeks later, and actually it saw a significant bump. And then we adjusted the dosage of the multifor from, like it was fairly high. It was like a 200 milligrams to just down to 1 tablet. And that was every second day as well. I responded much better to an alternate day dosing rather than every day. And again, the only way we know that, and I've done that with plenty of athletes, is by testing and retesting. And
Yeah.
it's exactly your point. Like you just can't take something, forever and not test and see what the response is to your body. Because iron, as we all know, too much iron can have just as negative effects as too low.
Yep.
So yeah, that's very good. But the iron supplementation in America is really difficult to sort. Like and again, I know one athlete is taking one called slow FE or slow FE release, which is, again, it's a form of iron they're saying is a slow release iron, but it's an individual iron. It's pretty much one of the only ones I can find in America, which is an individual iron supplement. They're all otherwise blended with. Hemaplex is a good example. Hemaplex is one that is very commonly used in America, but it's got everything and anything in it, huge amounts of B12, for instance. And I see athletes who start to take that, and their B12, again, it's serum B12, so I'm probably not too concerned, but their serum B12 goes through the roof. So if anyone does have a good suggestion for a good iron supplement in America, I'm certainly open to learning more about it.
So I would say, and follow up or another question, women in the menstrual cycle, is there a better, best, worst time to do blood tests?
I mean, it probably depends on what you're testing. You are going to see, this is an important point that I forgot to mention during the presentation as well, is that you will see across the menstrual cycle a little bit of variation in body water. And if that affects the blood volume, because when we generally measure these things in a blood test, we're measuring the concentration. So how many of these molecules per liter of fluid is it swimming around in? And so if the blood volume is substantially different from one test to the next, you're going to see a change in the concentration that doesn't actually reflect the change in the number of bits of whatever it is you're testing that are floating around. So that may be relevant across the menstrual cycle, but it's also relevant in the context of athletes, because if you're significantly dehydrated, that's probably not a great time to go for a blood test. And also things like ferritin, for example, will increase in response to the stress of exercise and it'll increase when you're sick as well. It's what they call an acute phase reactant. So in both of those situations, if you're going to go and do iron studies, you probably need to be well rested and healthy, like no cold or flu or anything when you go to do that test, or the result is really hard to interpret, because if the level is high, well, it's like, well, or, high as in adequate, it's like, well, is it only showing up in the adequate range because I'm a bit sick and actually I'm really low? Or is it actually normally sitting there? So timing around that sort of thing can be really important as well. Yeah, for sure. You might actually know more about this than me, Elizabeth. Do you tend to see, or have seen any literature around whether like full blood counts or hemoglobin change across a menstrual cycle?
Only in that they prefer women do it in the follicular phase, so the first half of their cycle, just because of a smaller hormonal fluctuation.
Yeah.
But I honestly don't know if that's because that's easier for medical professionals to interpret and they just prefer the lazy way out, or if that's actually more beneficial. So I just say in general, test at the same time of your cycle if you're going to retest. And then also if you can do it in the follicular phase, great. But there are other, like you said, like outlying points that might have more of an impact, that might be more beneficial.
Yeah. And certainly, like, sometimes, particularly sports doctors, if they're worried about sort of underfueling, that low energy availability REDS type stuff, they may actually want to go out and measure those hormones, either in testosterone in males and a whole bunch of different ones in females. And that's where absolutely the time in the cycle is critical for the interpretation of those results. So if the doctor says, I want you to test in this phase, you need to test in that phase.
Actually, and now that's a question I had, because you mentioned timing and something you mentioned there about exercise. And so what I've seen some athletes do is, they may forget to be fasted and they're told to be fasted and they don't do that, or they exercise on the morning of the blood test and go in fasted, which obviously can impact. And then the day before, they may do a really hard, like 3-4 hour session, then be fasted going into the session. So potentially dehydrated, all sorts of issues potentially. Like, do you have a sort of recommendation about like 20, at least the day before, just rest, just be active, but just rest relatively? Do you suggest anything like that, so that trying to build at least some control around what that blood test looks like?
Yeah, definitely. So I'd probably suggest to do it on the if it's a fasted test, the morning after a rest day or an easy day, and then you can go and do your hard session, like eat something afterwards and go do your hard session after that. So at least you've had the 24 hours beforehand, as you said, without massive stress responsive exercise going in there, and also probably on an easier day, just your general level of hydration is kind of, your kidneys and your sweat glands and your thirst and everything's kind of balanced it back to normal, compared to what it might be after a hard session where you may not have caught up by the next morning if it was an afternoon session or something like that.
Yeah, I think that's a great recommendation. Certainly, I'm sure you say the same thing, and you try and get it across to athletes. They don't always listen, but creating that level of control so there's some consistency with follow-up tests, I think it's just important. So, very good. Anyone else? Phil, Drew, Ginny, and Mike, do you have any questions? Oh yeah, Phil. Go.
Yep.
A simple question, maybe a more difficult question. Vegemite, how many tablespoons a day?
For B12?
Well, it probably depends on which country the person answering the question comes from.
Well,
I've got him hooked on it, Al. I've got him hooked on
wow,
Vegemite, so he loves it.
I'm hooked on it.
Do they hand out at aid stations in the States like the little ice cream stick with a smear of Vegemite on it?
I'm trying to figure out how to put it in a flask.
Right, there you go. Well, actually, there was a dietitian here in Queensland a few years ago who actually came out with a Vegemite flavored gel. It's not on the market anymore, but yeah, to try and get something savory for when you just get sick of all the sweet stuff all the time. It's called Geligmite.
Wow.
Yeah.
A little bit of a salt hit, B12s.
Yeah,
Fantastic.
yeah, it's not
nutritional
around anymore.
Yeast.
Probably not surprisingly, yeah. But yeah, that's a lot of sodium. 1 tablespoon of Vegemite is going to be a lot of sodium. 1 teaspoon is a lot of sodium. 2 tablespoons would be massive.
Yeah. So
I don't know, like a teaspoon. Teaspoon's enough. Like sodium and B12 and all the other B vitamins in it. I'd definitely say if you're eating a teaspoon of Vegemite a day, you're doing very well.
All
Mm.
right. On electrolytes,
I love that.
do we really need to take an electrolyte tablet a day, or can we just drink plain water and just eat normal food?
Personally, as a sodium researcher, I would say probably just eat normal food and have water. I mean, maybe some of those electrolyte tablets are going to give you some magnesium, for example, that might be helpful for some people if your dietary intake is on the low side. Certainly, I don't see the need to purposefully replace sodium out of sessions unless you're doing massive volumes of training and hardly having any sodium during the session. That might be an exception to that. Yeah, that's probably the main exception I'd make around that. Your kidneys do a very good job at balancing out the lumps and bumps in sodium ins and outs throughout the day. We did a study published at the end of last year at the university where we had people running for 5 hours on the treadmill, 30 degrees Celsius, so it's about 90 Fahrenheit, I think. They were losing about 1,200 milligrams an hour of sweat over the 5 hours. And what we saw, we actually collected all their urine for the 24 hours after they stopped running. And what we saw originally when I started running some of these samples through the machine, I thought the machine was broken because the sodium concentration in the urine was so low. It turns out, and this has been seen previously in the literature, is that your kidneys do a very good job within a couple of hours of finishing exercise. They realize that there's a big sodium deficit that you've occurred during exercise if you didn't replace it, and they go into massive conservation mode, and that's completely independent of the water, so you can still pee out plenty of water and almost no sodium at all. Now, will that get you back to where you started by the next morning? Well, it depends on how salty your diet is in that post-exercise period and how big the deficit was during the exercise session. So I think for most people training, an hour or two a day, I personally don't see the need to do that day to day. All it's going to do is make your urine more salty and your sweat a little saltier as well. But if you're doing a massive training session and you've got to back it up again the next day, then yeah, there might be some point to it. But yeah, if you're having a teaspoon or more of Vegemite, well, that's probably going to cover your electrolyte needs anyway, to be honest.
Right.
And
Perfect.
Phil, in the way we've got it written in the app is it's more a reminder. It's not like you have to take. So there's a reminder to drink water and there's a reminder to drink, I think, water plus or minus electrolyte. Exactly to Al's point, based on your individual circumstance, if you're taking a lot of sodium in food and you're only doing an hour or whatever exercise and you don't purposely need to do it because you don't need to back up, water's absolutely fine.
All right.
If in the
Thank you.
case of you've got a lot of high intensity exercise for a lot of volume and you've got second sessions and the next day and so on, then exactly as Al said, like individual basis. But the reminder is there just to remind you to drink some fluids.
All right.
And
Perfect.
again, it's even drinking the fluid is an individual basis.
All right,
What I would
thanks.
say there, though, Phil, is unless you have a particular risk of high blood pressure or you have high blood pressure, it's probably unlikely to be harmful if you do that. So sometimes it's just like if that encourages you, the flavor encourages you to drink more and just be better hydrated overall. I certainly wouldn't say avoid it. It's not going to be harmful unless you've got a concern around blood pressure.
I know here in the States, access to blood testing, a lot of times people have to pay out of pocket. So for people listening that maybe have to be on a budget, are there certain tests for athletes if they're like, okay, I can only get these 3, or what would be some blood tests that you think would be worth spending money on?
I think iron is probably, or the iron studies would probably be the highest priority because we just know that that's such a risk for athletes. The other ones, your cholesterol, your glucose, your insulin, those sort of tests, I guess those broader kind of health screening ones, they might be ones, I mean, they might be done in a workplace health check if you have that in your work, so you could get it covered that way. They're also probably ones that, if you're relatively physically active, you don't have, a family history of heart disease, diabetes, and that kind of thing, and you get a one-off and it looks pretty good, you probably don't need to test it that frequently unless something's dramatically changed, like you become much less physically active or your diet's completely changed or something like that, maybe a different story. But if your lifestyle's kind of stayed stable, and you don't have like you're not considered high risk, then you may only have to do that every few years just to keep an eye on how it changes as you age. Whereas if you're in that high risk category, you might prioritize that a little bit more. I think the B12, again, if you're vegan, I would definitely prioritize that. But otherwise, unless you're particularly concerned that there's a problem or perceive that there's an issue or a physician's recommended it, maybe not. And the same to an extent with magnesium. I think the magnesium test is still one in terms of how to interpret that, how to use it. It's kind of very much in its infancy, so it's nice to know, but I don't think we have any the actionable advice on that is not super specific at this stage. So it'd be nice to know, but it's probably not the end of the world. And just focusing on eating a better variety of whole foods, you're probably going to get a better magnesium intake anyway.
Now, just on the B12, I know it's something, and I don't know why, but I have read some studies on obviously serum B12 versus, say, active B12, but active B12 won't be ordered unless there's a fairly low level of serum B12, but the accuracy of serum B12 has been called into question whether it holds any value. Like, do you regularly request like a hollow TC or active B12 measurement if you were asking an athlete to get that if they were a vegan athlete, or are you concerned about that?
Well, I don't generally, because here in Australia, the doctors are kind of the gatekeepers to those tests anyway. So, I might say I recommend you get these kind of bloods done, but at the end of the day, it's going to be the doctor's discretion of what they actually order. Yeah.
In America, hollow TC doesn't seem to be even measured. Active B12, like athletes where they've spoken to their doctor about, and the doctor's like looked on the list and they can't even find it.
Well, it's the same with red cell magnesium over here.
Yeah. Okay. So, yeah, interesting. The only one I'd throw in there, probably just because I find it super interesting, is the Omega Index from a health perspective, and it's super actionable. And I know E will talk about that. I just find it's one of those ones that, and again, I know depending on the research and whatnot, and what you, follow with that, but I find it a super actionable test, and it's more for health, absolutely for health rather than performance. But historically, I've found a lot of athletes are very low on their Omega Index, and something that I just think like, they can easily intervene and change some nutritional intake if they're open to that, and you see some pretty impressive results. And if that means that they're eating better over the long term, I think that's a positive as well.
And sometimes, the tests are around, I guess, inspiring that behavior change, isn't it?
Yeah, exactly.
Some people could go, well, I don't need a test and tell me I need to eat more omega-3 and I'll just go out and do that, or buy fish oil capsules or something like that. But for some people, it might be the feedback they need to actually make that change happen.
And certainly we've seen that with a lot of the Fuelin athletes. They're like, wow, I didn't realize I was so low. And now, all my trash talking about sardines and anchovies is actually paying off. So it's great. Cool. I'm very conscious of time, guys. But Al, awesome. Loved it. Super practical, simple and effective. So thank you. It's always a pleasure listening to you and your wealth of knowledge.
No problem.
Awesome. Thanks everyone for joining. If there is a little feedback form at the end of when you log out, please fill it in, give us ideas, feedback for Al on the presentation, and then future Q&As. We always love your feedback. Thanks so much.
See you, everyone.
Cheers, everyone. Bye-bye.